So, good evening, friends. We have discussed yesterday 2, 3 aphorisms, and basically, we have discussed one important thing in yesterday's lecture, that homeopathy is not only science but it is also an art, and at the same time, the homeopathy is nothing but the system which is so true that it is as good as one straight line can be drawn between two given points. And that aphorism, that is aphorism number 53, we have discussed. Thereafter, he started comparing homeopathy with the allopathy, and he explains about what is there in allopathy. So in homeopathy, the principles are fixed, and that's why we are damn sure regarding the remedy. But when we go with the allopathy, everyone comes out with their own opinion because there are no fixed principles. It is rigid. Everyone comes out with something, and they explain, yes, this is my opinion, this is my thought, this is my speculation. And that aspect he criticized over there, and that's why he explained at the end of 54 aphorism, because of this method there are multiple materia medicas and which have different opinions regarding the same thing. So this is what we have learned, and we have learned there are 3 different footnotes, that those also we have finished in the last lecture. Let us start with the 55, what he says. Soon, however, the public become convinced that the suffering of the sick increased and heightened with the introduction of the every one of these systems and methods of cure if followed exactly. Long ago, these allopathic physicians would have been left had it not been for the palliative relief obtained at times from empirically discovered remedies. Empirically means which are based upon the only on observation or sometimes with experiments. Empirically discovered remedies with almost instantaneous flattering action. Flattering means खुश करणारी, दुसऱ्यांना सबको खुशी देने वाली. Flattering, instantaneous flattering action is apparent to the patient, and these to the some extent serve to keep up their credit. See, this is too important. What he is explaining over there is a very important thing. That still today is also the same thing happened, that where people are in fond of allopathy. They always goes to them first. Very occasionally, if you are a good homeopath, you are lucky enough to get the clear cases, that is without treated with allopathy, and directly they comes to you. Generally, we are born for that we get the cases at the end, when everyone have tried their level best, and then we get. So when we get such types of cases where difficult disorder is there, but still it comes directly in front of you, you can treat them and you can get the result very early. Generally, it never happens, and that's why people always go seek for the result in allopathy, and the thought is there in their mind that this gives instantaneous results. And yes, it is true to somewhat extent, because if you give the steroids to the patient who is suffering from any allergy condition, after 10-15 minutes the action is there and patient is settled. This is flattering effect. This happens very commonly, and people are fond of such thing because today in the modern era no one is having the time to wait for that. And if someone is not having the time to go for that, they always seek for the result. They always finds it out for the same thing, and because of which allopathy is still there, and allopathy is still weaning the people. This is the only reason because of which it happens. But if you treat patient instantaneously with the help of proper homeopathic remedy, you can also get the results. This is true, but only thing is that in such cases, in acute cases, you should be you should find it out very right remedy at the right time. I have seen many times results which are instantaneous. In fact, which are so instantaneous that you cannot think of. I have given one example that it was way back when I was not here in this OPD, my old OPD was there, and patient was brought directly from the Nasik to Sangamner. He was admitted in urology hospital. He was treated nearly about 8 days with the many hydrotherapy, and then even they have put the scope to remove the stone in the right ureter, but it was not possible for them. It was obstructed over there and it was not coming out. And patient was there in front of me. He came taking against medical advice, discharged from the hospital, and he came directly to the Sangam. And he consumed one injection before coming to me in order to relieve the pain. And he was sitting in front of me. I took his case, and after taking case, I found it he was very typically Lyco. Everything was denoting the Lyco. So I have given him lycopodium 30, one dose directly inside the mouth, and I was preparing the next doses. Within 15 to 20 seconds, he said, "Doctor, I have an urge to pass the urine. May I go?" And he went. And when he returned, he brought stone directly. So instantaneous is the action of the homeopathic medicine also, if it is the right stimulus. But people never know such things are there in homeopathy. They never understand. The one misbelief is always there with the people's mind that homeopathy is very slow in action. There was a joke on homeopathy that people makes, that you start treatment to the child and he will be settled when he was old. That is the joke they used to do. So this happens because this is the misbelief in people's mind, and you have to change that. So this is the only reason because of which the allopathy is there in the people's mind. So these were the measures which they used to use in their practice, and because of which it becomes a famous method of treating the patient. So that is the only reason Hahnemann says, because of which the allopathy remained over there, even though it has multiple side effects. Then he starts with the 56. Let us go with 56, what he says. By means of this palliative, antipathic. Now he is turning towards the next pathy, antipathy. In earlier two aphorisms, he explained about the allopathy. Now he turns to explain the antipathy. By means of this palliative, antipathic in antipathic method introduced according to the Galen's teaching. Those who are the students should write down, this is the MCQ. Who has introduced the antipathy? Galen. He has introduced the antipathy. Second important thing, what is the principle? It is written over there, the contraria contraris curentia. This is the principle of antipathy. Opposite cures opposite. So Galen's teaching, contraria contraris, for 17th centuries, the physician hitherto could hope to win the confidence while they deluded with almost instantaneous amelioration. So Galen was there to show the instantaneous results with this contraria contraris curentia. But what he used to produce the results? One of the symptoms out of the totality for which there is an opposite remedy having exactly opposite action. For example, patient is suffering from constipation for 5 days, and here there is a medicine which acts exactly opposite to the patient's symptoms. It produces the purgation. So if you give that purgatives, what happens? Immediately the patient feels better, because after consuming the purgatives, he passes stools immediately, and patient is happy for time being. That is what is called as a palliative mode or palliation. So it is instantaneous elevation which happens with antibiotic. But what he says further, but how fundamentally unhelpful and hurtful this method of treatment is, in diseases not running in rapid course, we shall see in what follows. So what he says, such a method is how much instantaneous amelioration is followed by harmful things. There are many unhelpful things, hurtful things happens because of such a measure. It is certainly the only one of the modes of treatment adopted by the allopath that had any manifest relation to the portion of the suffering caused by the natural disease. But what kind of relation? What he said? It is one of the method which is followed in allopathy and which has some at least principle. Allopathy doesn't have its own principle, but allopathy follows antipathy, and antipathy has a principle, contraria contraris curentia. So there is at least some relationship. Patient symptoms are there and exactly opposite action of the remedy is there. So symptoms which are produced because of medicine are exactly opposite to the patient state. And allopaths try to use this antipathy, and that is the only method in which some principle is there. Of a truth, the very one, the exact contrary of the right one, that ought carefully to be avoided if we would not delude. Delude म्हणजे बुद्धी परस्पर फसवणूक करणे, to deceive someone. We would not delude and make a mockery. Mockery म्हणजे उपहास करणे, चेष्टा करणे एखाद्याची. And make a mockery of the patient affected with the chronic disease. So what he is explaining over there, that if you are treating any chronic disease in such a manner with such a measure, you are deluding the patients. Because when you give such medicines to the patient, the only thing which happens over there instantaneously is the palliation. And that palliative action is only for time being. It never remains persistent. And whenever that palliation disappears, it is always followed by an aggravation. That is the rule. Palliation is always followed by an aggravation. So what we have learned, the second condition generally happens when two dissimilar diseases meets inside one human being. If the old one is weaker, the new one is stronger. The new one removes the weaker one for time being, or it suspends the old one time being. And when the action of new one disappears, the old one reappears. The antipathy works on the same principle. And because of which, primarily palliation is always followed by an aggravation. And this is harmful for the patient. If the patient is suffering from some heart trouble, he is having some, for example, he is having the severe tachycardia, the control of the pulse rate is not there, and patient has given some medicine to control the tachycardia. If he by mistake, he never take that medicine again. And what happens when the action of that medicine vanishes? Ventricle can go into the flutter also, because palliation is always followed by an aggravation, and such a thing happens over there many a times. And this is what he wants to explain over there, that this method, the antipathic method, is not at all useful to the patient, specifically when you are dealing with the chronic cases. There is one footnote, but that footnote is related with the isopathy. Before that, we have to understand the antipathy clearly. So my suggestion is that first we'll learn the 57 aphorism, and then we'll turn towards the footnote which is given over there. Because that is the third method of treatment. So we'll first read about the 57 aphorism and what he says in 57. In order to carry into the practice this antipathic method, the ordinary physician gives for a single troublesome symptom from among the many other symptoms of the disease, which he passes by unheeded, a medicine concerning which it is known that it produces exact opposite of the morbid symptom, sought to be subdued, from which he can expect the speediest palliative relief. He gives large doses of opium for the pains of all sorts, because this drug soon benumbs the sensibility, and administers the same remedy for diarrhea, because it speedily puts a stop to the peristaltic motion of the intestinal canal and makes it insensible, and also for the sleeplessness, because opium rapidly produces a stupefied comatose sleep. He gives purgatives when a patient has suffered long from the constipation and costiveness, and he causes the burnt hand to be plugged into the cold water, which from its lower degree of temperature seem instantaneously to remove the burning pain, as if by magic. He puts the patient who complains of chilliness and deficiency of vital heat into the warm baths, which warm him immediately. He makes him who is suffering from the prolonged debility drink wine, and whereby he is instantaneously enlivened and refreshed. And in like manner, he employs other opposite antipathic remedial means, but he has very few besides those just mentioned, as it is only of very few substances that some peculiar primary action is known to the ordinary medical student. So what he explains in the 57 aphorism, he explains many examples of antipathic measures. So there are very few. For example, opium is a very important drug which has a capacity to produce many actions. Opium is a good purgative. If opium is a good, in fact, it is not purgative, it produces constipation. Opium produces sleep, very comatose sleep immediately. Opium is acts as a directly analgesic because it relieves it benumbs the nerves, and that's why pain gets stopped. So that type of antipathic action is there always opium, and that's why the opium derivatives are all analgesics in allopathy. Even opium is always given to the cancer patients also. Those derivatives are always there because it relieves the pain instantaneously. But how it relieves the pain? Yes, instantaneously it relieves the pain. But when you stop giving the opium, the patient comes with an aggravated phase. Many a times patient goes on asking more and more and more and more about the remedy, the dose, and he goes into the he goes beyond the limit of therapeutic dose of the medicine because it works in the palliative manner and followed by an aggravation. And this is what he explains over there. Antipathy is not the curative mode of treatment, but it is only palliative measure. And this aspect he has criticized over there, and giving different examples. You know many times that patient who are there on the sedative pills, then they takes first pill, they feels very happy. Next day they are very happy because they got very good sleep. And next day when they suffers, next day when they are going to sleep and they never consumes the medicine, what happens? Next day they never get a sleep because it immediately produced direct action over there, and he requires the same dose again. It becomes an addiction, and dose goes on increasing in this manner. And this is a common example which you can observe in many families. The people who are consuming daily a sleeping pill, some at start they requires very few dose, 2 milligram. Then after some time they require 5 milligram. After some days they require 10 milligram. So gradually it goes on increasing because because when the patient becomes accustomed to that specific mm, dose, then he never gets the effect of it. And if he wants to result, he wants to increase the dose. And this is typically a palliative mode of treatment, which you used to find it out with antibiotics. So he explains first the allopathy, then he explains the antipathy and its principle. And there is a big footnote where he explains isopathy along with the vaccinations. Both things he mentioned in that aphorism, in that footnote, the footnote number 63. So it is too important to read 53 or 63. I don't know exactly. It is not clear over there. A third mode of employing medicines in diseases has been attempted to be created by means of isopathy, as it is called, that is to say, a method of curing a given disease by the same contagious principle that produces it. But even granting this could be done, yet after all, seeing that the virus is given to the patient highly potentized and consequently in an altered condition, the cure is effected only by opposing a similimum to the similimum. So he is explaining the third important thing, that is isopathy. Isopathy was invented by William Lux, and principle was equalia equalis curantur. It was not of a practical value. It was not experimented science. This was just speculation of the Lux, who was lazy person and who considered that it is very difficult to read all those medicines and mug it up, understand them. It is always better to come with some thought, some idea. And he has developed one idea in his mind that if a patient is suffering from the pus anywhere in the body, for example, in the ear, let us take that pus, saturate it, and give it to that patient so that will cure that pus. That was his thought. He never experimented, but directly declared it to the world. Yes, this is my pathy and this is isopathy. And this method failed because it was never experimented in. Anyone says over there regarding this, it never works. Because such sciences are not the sciences, they are not experimentation. No one have done the experimentation but introduced such a thing. Another thing which he explains over there, last sentence which was there are many people who used to use vaccines. It is very famous nowadays. The child to whom I used to say bichara child, because right from the day first, he was it has been developed the stramonium state in the child. They used to give the injection right from the day one to the child. And what do they give? They starts with BCG vaccine, then the oral polio and triple vaccine every monthly. Then there are nowadays there is a so big list of the vaccines that nearly for first year the child is always having some of the injection, and he goes into a state of fear of injured of being. This is common with the children with which they approach to us. So this is very common. But how this vaccine works? Some who has invented the vaccine? Anyone knows? Who was first? Who came out with the vaccine? The first vaccine prepared was the Jenner, who has prepared the cowpox vaccines against the smallpox. Vaccine was the first one. It was introduced on the principle of one thing: simillimum is repelled by the simillimum. Simillimum is repelled by the simillimum because this virus used to produce the similar effects, and when you give that vaccine to the person, it produces the same state inside that human being prior to get the disease, and because of which that disease never enters inside body, and this is based upon the principle of simillimum is repelled by the simillimum, which is not homeopathic. When we have learned the aphorism number 44, 45, what he says, when two natural similar diseases meets inside one human being, they neither repels nor suspends or never forms the complex disease, but the stronger one removes the weaker one permanently. Here, there is no repulsion in homeopathy. In vaccine, there is a repulsion. And that's why the principle of vaccine and homeopathy is absolutely different. And if anyone says the vaccines are prepared on the homeopathic principle, it is wrong. Tell them clearly that it is absolutely having a different aspect. Hahnemann explained over there. Here, the opposite, what he says, only by opposing a simillimum to a simillimum. What he further says in that paragraph, let us see. To attempt to cure by means of very same morbific potency per item, that is isopathy. Per item shabdata artha isopathy. If it has been asked in the exam, short note per item, you have to write down the isopathy. Per item contradicts all normal human understanding and helps all experience. Those who first brought isopathy to notice probably thought of the benefit which the mankind received from the cowpox vaccination, by which the vaccinated individual is protected against future smallpox infection and as it were cured in advance. But both cowpox and smallpox are only similar, in no way the same disease. In many respects they differ, namely in the more rapid course and mildness of cowpox, and especially in this, that it is never contagious to the man by mere nearness. Universal vaccination put an end to all epidemics of that deadly, fearful smallpox to such an extent that the present generation does no longer possesses clear conception of the former frightful smallpox plague. So it was first introduced in the vaccine was the cowpox vaccine. It was the preventive for smallpox. Yes, it worked definitely, because cowpox was the disease caused because of the same virus in the cows, and that was considered, that was taken, and the vaccine was prepared, which has many similarities in the smallpox. But the pace of smallpox was mild, and comparatively it is not so contagious, whereas the smallpox was very contagious and very dreadful. In fact, many deaths have been happened because of the smallpox. But when the vaccine was prepared and given to the people on a mass scale, it has eradicated the smallpox. It was a big win. And on the same principle, Lux thought that if we give same medicine, it might act. That was his thought. But that was not his experimentation. The vaccine was experimented first. The cowpox vaccine was prepared, then it experimented with the animals. The certain group of animals it was given, and certain group it was not given, and then the smallpox virus was given to both of them. Those who have not received the cowpox vaccine died because of that, and those who received the cowpox vaccine remained safe. That was the experimentation. It was totally based on experimentation. So that was scientific. But the thought which developed by William Lux was not at all experimental. And he just by his thought, by his speculation, directly explained the concept of vaccine. So this is the difference between these two things, and one has to understand. And then he further says in the footnote, moreover, in this way, undoubtedly, certain diseases peculiar to animals may give us remedies and medicinal potencies for very similar important human diseases, and thus happily enlarge our stock of homeopathic remedies. So if we know that certain medicine is having direct action on the human being, which is prepared from the animals, and we get many more medicines, but which are used on the basis of experimentation. When we have many animal remedies, which are prepared from the animal secretions, animal discharges, which are prepared from the milk of the many animals. We have lac caninum from the dog's milk. So many more remedies are there. Even poison from the snakes, we have the remedies. So these are the medicines, but which are prepared on the strict homeopathic principle of the doctrine of drug proving. They are not used on the just a thought. There was in between, there was one post which was very viral, written by some unknown homeopath, or who was ignorant homeopath, who has written over there, the naja is the remedy for all snake poison, and you can get it in 5 rupees. Such a bad rumors, mad things happens. This is not the homeopathy. This naja cannot be a remedy directly for every case of the snake poisoning. In fact, not at all. From naja, we have the remedy, but which has a totally different presentation. In fact, from our Matra Medica, even though the naja is the remedy prepared from the king cobra, it is the snake remedy, but still it is less angry remedy. Most less angry, very cold remedy, naja. So if someone comes with some thoughts, it's not at all homeopathic and not at all a scientific. And this is what happens when we observe the things in the. And what he says further in the paragraph, but to use a human morbific matter, a sorin taken from the itch in man as a remedy for the same human itch for evils arising therefrom is. Nothing can result from this but the trouble and aggravation of these. Yes, if we consider that sorin is taken from the eruption and used for the same purpose, yes, it is not homeopathic, then it becomes isopathic. If we take that and prepare remedies, soranum has its own presentation. It has been proved on healthy human beings. Soranum is the most chilly remedy of the materia medica. Soranum has a wide range of symptoms. It is not specific to that specific eruption, not at all. You cannot prescribe soranum to such a patient. And this is not a homeopathy. This thought is isopathy. And such a thing, which he explains over there, criticizing isopathy, that it is not a science which is based upon any experimentation, and that's why isopathy fails. So today we have learned two aphorisms along with one footnote, and we have learned about the antipathy. At the same time, we have learned about the isopathy, vaccination, and concept of vaccination based upon the concept that similimum is opposed by the similimum, and all those things which we have learned in today's session. Those things should be known to us, because there are many queries in people's mind, and you should be very firm regarding it. When anyone asks you question, you should be able to tell them what is homeopathy, what is isopathy, what is antipathy, what is vaccine, why vaccines are not utilized in homeopathy, and why you never asked to take the vaccines. All those things you must know, and for that purpose your concept should be very clear in your mind. So Hahnemann, while writing down all those things, writes in so detail and explaining, giving the reasons, that one never fails, or he never fails, and one never forgets to understand the Hahnemannian concept. So this is what he mentioned over there. So today we'll stop over here. Tomorrow we'll continue with the next aphorism. And my suggestion to all of you is that whenever I'm teaching or taking those aphorisms, it is your duty to read them again, so that it will become very clear in your mind. So thank you being there, everyone. Thank you, sir. Warke, sir. Thanks, Ali, and everyone. Dr. Anita, Chaitrali, Kirti, Rajiv, Preeti, Prasuna, Harsh, Harshal. So thanks a lot. We'll meet tomorrow. Any query, any question?
Sir,
Hmm?
sir, is there any preventive, or you can say like for the newborns, the moment they born, we give polio vaccination, or like you said earlier. So, or we don't have to give any preventive measures like,
Basically, when the infant is born, he is healthy.
right,
You
sir?
make him sick because of vaccinations. He is in harmony, and when you give a vaccine, you produce a disharmony. You stimulates one of the only specific immunity, and while in stimulating that, the harmony in the your immune system gets disturbed. So generally, if you maintain the general immunity of the child, there is no need to give the vaccines. This is too important to learn and to understand. My suggestion is that if the child requires any medicine specifically, then it is a need to give the medicine. If he never requires, why to give the medicine also? Medicine is the need when it has been needed. Otherwise, it should not be provided. So you observe the children who have not received the vaccine, they are always healthy. And you give them vaccines and then see the pediatric OPDs, they are full of respiratory allergies. They are suffering from coryza, they are suffering from cough, bronchitis, asthma, and many, many more. And they are always on the different vapors they used to give. This is common thing which happens. So basically, no need, and whatever is you have to give is the constitutional remedy that works as a
Right, sir.
better remedy for that child.
सर, अगर उन दिनों कोई एपिडेमिक चल रहा हो, कोई वायरल इस तरह का हो, जब वो न्यू बॉर्न
Then
हुआ है, तो उसमें हम
genus epidemics, whatever may be the common of that epidemic, that you can give a single dose, which stimulates the general immunity. General immunity
राइट
is
सर.
always better. Okay.
थैंक यू सर, थैंक यू.
Thank you everyone being there. We'll meet tomorrow. Thanks a lot.